Okay, welcome everyone to the third Hot Politics Lab this the fall semester 2020, and welcome everyone. And we're going to have a great talk by Catharina de Vries, and I just want to apologize for starting a little bit late. It's actually a continuation of a long tradition we had at the lab. When we were still meeting physically, we always started late because we couldn't find the cables to connect either the computer to the beamer or the remote control. Some issue like this. Okay, I'm really happy to have Catharina de Vries here today. She's a professor currently at Bocconi University. Catharina and Bert and I, we go a long way back, and Catharina's been a mentor for both Bert and I when we were still young and innocent, and I think over time this has developed into friendship. So it's always nice to be able to invite such people to the lab. Catharina is really one, I'd say, at the top of political science globally, producing great articles on very distinct topics like party politics, European integration, corruption, and I'm probably forgetting one or two key topics here. Today she will talk about how to get rid of boomers, at least if I can see the title. So that's like a very important and socially impactful research, I think. But more specifically, she will talk about how COVID-19 might feel intergenerational conflict, as you can see. And there are people from two ERC projects involved. So one I'm not familiar with, but the last project is Catharina's recently started ERC project. So I'm really looking forward to this talk. As always, the talk will be about 20 minutes, and then we'll have time for Q&A, and you can type your questions into the Q&A box. Without further ado, I'll give the virtual space to Catharina.
Okay, great. Thank you so much, Vries. I think your introduction already illustrated the intergenerational. I was a mentor for you guys when you were young, so that means I'm old now. So in that way, we're already talking about intergenerational aspects. No, I'm just kidding. No, it's really great to be here at the lab. I think it's great what you guys have set up. Not only you, but everybody who's involved at the Hot Politics Lab. In some ways, maybe this is also hot. I was thinking, like, how does this relate to hot politics? Well, this is a hot topic when it has to do with kind of COVID-19. And it's also something that's ongoing. I want to stress, so I think Paula Rettel, if she is correct, is also in the audience. This is one of the, is a PhD student who works on the LOSS project, and then Francesco Billeri, who is a sociologist. This is also part of his ERC project on more demographic aspects, and this is where the two things combine. So a couple of political scientists with a demographer and trying to understand COVID-19. I do want to say that I'm going to go through the slides, but this is hot off the press. So Paula and I were like still thinking about it this morning. So we're just going to present you, this is a pre-registered plan. We're going to present you the kind of the results, the way they are and what we see. And then it's going to be clear that, some things we didn't think about properly, and etc. And we would really like to have your feedback on how to make this the most kind of interesting paper that we can. And for those of you who kind of think about, how you want to give comments, we're thinking about this probably as a longer paper, and you see why that's the case, because some of the results are more complex than maybe you thought. So I think this is more aimed at a kind of longer journal article rather than a very short paper. Anyway, so maybe some of you have been familiar with COVID-19 being called the boomer remover. This created a lot of conflict. Also, when you look at Google Trends data, this in mid-March went up the search dates a lot for that. And that's because on Reddit, there was this meme that went viral, and also on Twitter there was another tweet. This is a tweet that was, I think, now already almost 1 million times liked. So like we're talking Donald Trump amount of likes on the boomer remover. I have been informed by a relative who's a middle school teacher that students are now referring to the coronavirus as a boomer remover. So the reason why that's the case, this is early data from an Italian institute about the infected fatality rate. I'm not going to go into, there's different ways of doing kind of mortality rates, but this is of the infected people, what was the fatality rate? by age class. And of course, what you really see, and that was also very clear in where the pandemic hit in Italy, we're in Lombardy right now, was in places like Bergamo, for example, where 75% of the population is over 70, right? So this was what we know is that the coronavirus really strikes with people who are over 70 and especially also who are over 80. So the elderly are disproportionately affected by COVID-19. However, the economic impact that's associated with what we here call non-pharmaceutical interventions. So non-pharmaceutical interventions are basically not doing anything in the hospital, but doing things like lockdowns, right? 1.5 meter economies, like these type of elements, right? So the economic impact of that crisis, in order to save people from this high lethality rate, so we're especially talking about saving the elderly, if you will, the economic impact really disproportionately hit the young. So this is data from the UK, where we look at the biggest decline of employment has been among the youngest workers, so those between 16 and 24. And if you go to other recent analysis in the US or in the UK and also in Italy, they think that this will be, economists think and labor economists think that there will be a lasting effect for a generation. It might be a missing generation. Sorry for all of those who are going to be on the job market soon. So this led also to a lot of kind of tension over non-pharmaceutical interventions, right? So over these lockdowns. Things like written in the FT, like we're prioritizing the old and we'll have to make it up to the young. There was the podcast this week in The Guardian about why blaming young people for COVID-19 could spike and backfire. It's also the idea about does it actually help in preventing them from doing things? But actually on the top of the discussion, I have to say, was the Dutch discussion, where you had a columnist, Marianne Slagerman, who wrote a column about so-called doorhout, so that's old wood. So the element in that, well, why are we kind of like, why are we locking up the young branches that are going to be trees in order to, prevent those from dying who are already going to die, right? That was the kind of piece of her column. Then Jort Kelder, for all of those who are Dutch, know he's always someone who in the public debate tries to put things to the extreme, but he said, why are we saving 80 plus people who, did not live healthy because they were in a different time, who were too fat, who smoked. So, this is ridiculous. So these ideas of, that we have to lock up the young in order to save the old. So kind of in this backdrop, I was a Dutch person living in Italy and then saw many of the discussions being very different in Italy than in the Netherlands, especially when generational language or generational rhetoric was used. We kind of started to think about this together, and we focused on two research questions. To what extent does highlighting the trade-offs associated with non-pharmaceutical interventions, like a lockdown, increase intergenerational conflict? And intergenerational conflict, we here try to measure by attitudes and preferences for policies towards different generations. And then to what extent do empathy and contact, as well as economic dependence of all the generations, so interactions, if you will, and your feelings towards all the generations, measured through self-reporting, but also by varying country contexts, where we know that there are differences in some of these factors, reduce an intergenerational conflict. And the primary point we take from that of focusing on these trade-offs and then focusing on empathy is also work that was developed by Claire Edida and others on the effects of pandemics on outgroup prejudice. In this case, she looked specifically at prejudice towards Africans when it had to do with the Ebola pandemic, right? So, and here we try to kind of go on the element that those kind of lockdowns really brought home this tension between young and old, right? And we know from other research on housing and other things that there is potentials for intergenerational conflict, and we just want to check if kind of the pandemic might be an accelerator for that that conflict. So I want to go to the results, but very quickly in terms of what we thought as expectations. So we think that highlighting this trade-off embedded in these non-pharmaceutical intervention increases intergenerational conflict, or reminding people of those trade-offs. Then we think that this is less pronounced among those who are in frequent contact with or who are economically dependent on the elderly, right? And then in order to get this sense of like that intergroup conflict might be mediated to some extent or prevented by empathy, inducing perspective-taking empathy. I'm more than willing to go back into this entire discussion in empathy, how you call that, but this is basically trying to understand someone else by taking their perspective. that's what perspective taking empathy is, by highlighting the worries of the elderly, decreases this intergenerational conflict, especially among those who already report more empathetic concern. Just to give you a sense of it, we find evidence for 1 and 2. We don't find any evidence for 3 and 4, right? So I'll try to go through that in a minute. So we then do survey experiments, which I'll explain in a minute, in 2 different countries, in Italy and the Netherlands. And why did we choose Italy and the Netherlands? Because these countries are really at the opposite ends of age structure of public spending. So not just of a more older population in Italy than in the Netherlands, but also that in Italy, there's much more a system that benefits the old. It also links to the fact that older people in surveys are perceived as having more status than in the Netherlands, for example, where the Netherlands is being more balanced in terms of age. So there's as much spending for young as there is for old. And in Italy, it's very much geared towards the old. So you have a very different policy context when it comes to where this pandemic hits, right? So just some elements. So for example, in the Netherlands, long-term care for the elderly is done via, there's a lot of spending in that in order for people to do that outside the home. Whereas, for example, in Italy, many elderly people live in intergenerational homes, right? And this was, of course, also a part of the pandemic, but it gives a very different context for how generations interact and how they might be perceived. So that's why we thought of this context. And as I said, this is also reflected in public opinion. Age, for example, explains much more policy preferences in the Netherlands than in Italy. So to think about this context, we also pre-registered some country level expectations. So we thought that the effect of highlighting the trade-off embedded in non-pharmaceutical interventions on intergenerational conflict should be more pronounced in contexts where generations rely less on each other to obtain care and resources. So that's in the Dutch case, where there's a lot of state spending on these things, and it's not necessarily done privately by the family. And secondly, that inducing perspective-taking empathy should lower intergenerational conflict, especially in contexts where we know that empathetic concern with the elderly is already much more widespread, which is in Italy. Note that we find no effect for expectation number 2, and we find evidence for expectation number 1, but the reverse. So, and I'm just going to talk a little bit through at the end of why we think that's the case. And I would also like to hear your ideas about if we should maybe do we have some money to do a follow-up study if we should. So we have some ideas, but maybe we should or not. So just the survey experiment. So if you have comments on the survey experiment, and it's so crucial, we could actually run something else, but this is already run, right? So in that way, just to give you a sense of where we're at. So we run a control group, which is a baseline condition, which has no vignette. So you just get a set of outcome variable questions, outcome variables that you have to respond to, but you get no additional information. So in this trade-off and empathy treatment, right, that's what we're going to try to induce. So this trade-off in this lockdown, a non-pharmaceutical measure, and the empathy, we first want to make sure that people understand the generational effect of COVID, right? Because that's where we start our thing from. So we do a little information clip at the beginning, which is basically taken from the WHO website. So COVID-19 is an infectious disease that can cause severe respiratory infections, pneumonia, and severe circumstance death. Although all age groups are at risk of contracting COVID-19, most people who develop a severe form of the disease are elderly people over 70-year-olds, right? So this everybody gets that is not in the control group. That's either in the trade-off or the empathy one. So in the trade-off treatment, you get that informational text and an additional informational text. In order to protect older people, countries around the globe have enforced strict lockdowns that do not allow young and highly productive people to go to work or school. Due to the adverse economic effects associated with lockdowns, many young people might face reduced job prospects and find themselves out of a job in the near future. And this is basically taken from some of those editorials that, for example, were published in the FT. So that is the type of language that we use. And then in order to make sure that people understand, have read the treatment, and this kind of also worked, we have looked a little bit into that, but not systematically yet, but it seems to work, is then we have the question, which is usually used by social psychologists, things like that people have to write something down. So think about the consequence of lockdown for society and how it affects different age groups. To what extent do you think that the effect of the lockdown is dependent on age? So for them to kind of think about the thing we want to induce. So the empathy treatment is that same information about COVID-19, right, which that affects the elderly more in terms of lethality. Then they get many elderly people have expressed how concerned they feel after being informed by their doctor about COVID-19 outbreak. One elderly man of 82 states, my doctor told me that I'm not eligible for an ICU place if I too get COVID-19. He told me that I would have to stay at home even if I would fall really ill and I could not breathe on my own. I feel horrified when I think that I may die, not only without proper health care, but alone since my relative would not be allowed to visit me. Note that this is taken from an interview of Nieuwsuur. Nieuwsuur went to Brabant and interviewed a couple of old elderly people, and this was a guy of 82 that said this. So we're trying not to give any information that's not already in the public domain. And then the question is there, this is this perspective taking empathy, try to put yourself in the shoes of an elderly person, try to imagine the limitations and the risks that you would face as this person. What would you do to cope with the mental health issues during COVID-19 outbreak, right? In order to kind of induce that perspective taking empathy. So then I think the number one thing that we are not going to repeat in any future survey is to have as many outcome variables as we have in this particular one, because it just becomes very complicated to do the analysis. Anyway, that's already said. What we try to do is to kind of get attitudes towards the elderly. We have a set of policy preferences about policies that affect the elderly vis-a-vis the young, and then we have a semi-behavioral measure. So the European Social Survey, the European Value Survey has these set of questions which are also used to, to get at prejudice towards the elderly. I'm interested in how you think about people in your country view the people of 70, which I mean prestige, social standing, position in society, and it's extremely low status and extremely high status. The next one is older people get their fair share of government. Do you agree or disagree with that statement? So the thing is, you're not asking, do you hate elderly people, right? That's not a way, that doesn't work because it's socially desirable. So this has been developed by sociologists to develop kind of an idea of attitudes towards elderly. Then support for policies. We look at pension levels, because that of course really affects the elderly. Then things like people in their late 50s should give up work to make way for younger and unemployed people. And those are taken from the Eurobarometer, and then suppose two equally sick people need the same heart operation, one is 30 and one is 70, to what extent do you agree that the 30-year-old should get the operation first? Then the final thing that we do is take a behavioral outcome that's again based on work of Claire Dida, where we would ask people if they would like to write a message to the Prime Minister, Giuseppe Conte or Mark Rutte, if you're in Italy or the Netherlands, in support of promoting the rights of the elderly. The message is completely anonymous and will be delivered to him in the next few weeks. And then it's yes, no, and then it's that if you do yes, you have a message, and then we code that message as in being in support of the elderly or not. Note that most of the people who chose to write a message, it was in favor, but there were also some people saying like COVID is a hoax and like things like that, right? So there was also some other things, and those we coded as 0 here because they didn't really comply to this idea that you would have to support, write something in support of the elderly. So this is just a model specification. So we have to deal with the fact that we have NUTS1 regions, et cetera, that we have different regions and might be differently affected by the COVID-19 crisis. For now, we haven't operationalized that. We just take it all out with fixed effects, basically. But maybe we want to also look into that a little bit more. So then we have treatment variables, trade-off that compares a respondent that's assigned to the trade-off treatment versus control. Empathy is assigned to the empathy treatment versus control. And then we compare those that have gotten the trade-off treatment against those that got the empathy treatment, right? So those are the kind of 3 coefficients that we'll show you. So these are the main effects of the trade-off and empathy treatment for these different outcome variables. So just so that you already know, so we find virtually nothing on policy preferences. So maybe for political scientists, that's not entirely crazy, right? That we think that policy preferences might be driven by things as ideology. So maybe they're not as moved as quickly by these type of treatments. We do find things for status, so how people have the perceived status of elderly in society, their share of government, and then we find something for a message to the Prime Minister party. Interestingly, what we find virtually nothing on empathy across the different measures, but we do find things on this trade-off effect. So for example, you've got this trade-off treatment, you're more likely to say that like the elderly get more than their fair share of government policy, for example. And if you have this, it's here not statistically significant, but in some other ones it is, that if you get this trade-off treatment, for example, you might be less likely to write something in support of the elderly, right, to the Prime Minister. So then we tried to look at these empathetic concern. Remember some of these hypotheses that we did. So actually what we thought was that this empathetic concern might move this empathy treatment the most, but we find nothing on empathy. What we do find is that in the high empathetic control, the people who display high empathetic control, note these are all measured pre-treatment. that the trade-off versus control for the high empathy, actually, if you get that trade-off, you are more likely to respond to that treatment. So you're more likely to display a attitude toward the elderly, which is not necessarily particularly positive. We find no effect for the Prime Minister Party. As I said, we find very little for the policy preferences, so I just leave them out here. So that's the kind of counter what we actually didn't have any, to be fair, we had no hypothesis on the effect of high empathetic concern or low empathetic concern on conflict, on the trade-off, right? So we do find evidence for that, nothing for the empathy. Then by contact, so we remember what we thought, that maybe this trade-off control treatment would be less pronounced for those people who have high level of contact, that there might also be something going on for empathy. And actually across the board, we find very little evidence here. They're not statistically significant, but also the coefficients are very similar across the two. So we find less evidence than we would have thought for contact. So then economic dependence, what we do find, and here I want to get a little bit your thoughts about how to deal with this. And one way you could read and say, well, it's not really different because the coefficients are very similar in size. But of course, there's less people who are economically dependent, who are fully economically dependent on all the generations, right? So the confidence intervals are a bit larger for that group. But overall, if we still think that we could infer, I don't know the best way to go about that, maybe to adjust that in the future. We haven't done that yet, but you do find some effects for those people who have low economic dependence. So this trade-off treatment seems to work particularly for them, right? Which is not entirely surprising and they're also less likely to, for example, write a supportive message to the Prime Minister. And that would not be entirely surprising if we think that those people have less of this, are more free from economic burden, from economic dependence on the elderly, right? So we did some exploratory analysis, which was not in the pre-analysis plan. So try to just get a little bit of a sense of it. So those of you might think, well, this should all be affected by age, right? So you might be a different, we ran the sample below 70, right? So not to get the elderly in there, but we actually find little evidence for heterogeneous treatment effect based on age, but we do find triple interactions. So, but we want to look a little bit more carefully into that. So looking at empathetic concern by age, right? So then the effect seems to be especially among the younger respondents, what we find, right? So that probably could make sense that through that trade-off, younger people start identifying more with the younger people who are being traded off, if you will, in that treatment. So that makes sense, but we have to explore that a little bit more. Also of ideology, we don't find any direct heterogeneous treatment effect, but there seems to be also something going on in the triple interaction. And then interestingly, I think what we would be more interested in kind of conveying and working in further, that we had also a set of COVID perceptions. So things, for example, of own compliance to health measures, perceptions of compliance of others, but also questions about COVID worries. So how worried are you about the disease? And what we find is quite stronger treatment effects on this trade-offs, on this lockdown treatment among those who are very worried about COVID-19, right? So that will be interesting to explore. Also maybe looking in Italy, for example, where we have much regional variation in how much your region was hit by COVID, is try to look a little bit into that, but that is exploratory, right? It's not pre-registered. So then and these are anyway, I'll leave it for time. These are these effects for COVID worry. So then the last thing was we had this expectation about different contexts, right? So we thought that because if you're less dependent on the elderly, because the policies are more, allow elderly to live in an elderly home, for example, and there are more resources put also for childcare, that these effects of the trade-offs should be more pronounced. But actually what we find is the reverse. So we find actually that these trade-offs effects are driven by the Italian context and less by the Dutch context. And then when we started looking at that, is that there's more intergenerational conflict already in the Netherlands. So there might be a little bit of a ceiling effect going on. And then when we started looking at, and we don't find again something on, we find it on healthcare in Italy, but not on pensions and work anyway. So when we're thinking about context, so why do we maybe find stronger effects of this trade-off treatment in Italy, which is counter to what we expected originally, is actually when I was in Italy already, maybe as a Dutch person, I could follow both of those medias, that the generalized political rhetoric in Italy is very different than in the Netherlands, right? So this is just giving you one example where Mark Rutte, especially in his his first herd immunity address, right? Did this sense about, oh, we need to kind of protect the vulnerable by putting them away, and then, and we need to get the younger people to kind of, get infected, right? And then, but Mattarella was the president of Italy, was very much talking about the worth of elderly and how they had supported the nation and how we could not fail them, right? So the political rhetoric is very different. So what I was also thinking a little bit about, and Paula, that this trade-off treatment in the Dutch case might not be so salient, if you will, whereas in the Italian case, you hardly hear this in the public debate. So it's more, let's say, countervailing information. So maybe people might be reacting it more closely. It would be maybe interesting to look at, do some content analysis of the debates in order to prove that. I already said that there's some ceiling effects in the Netherlands. And then we also thought that maybe the discussion of COVID-19 in the Netherlands very early on, from end of March already, with this Doorhout column, was very, very in this kind of a trade-off idea, right? It was very pronounced already in the Dutch debate. So again, not only that the generalized political rhetoric about elderly is different, but also specifically in COVID-19, it was already much more there. So maybe people couldn't, we did these studies in June, people couldn't really be treated on that anymore in the Dutch case because it was already so pronounced, right? So in that way, it is kind of interesting for us to think about context, and that's what I will end on. Sorry, I went a little bit over, but to get a little bit of a sense maybe on, yeah, COVID-19 by these trade-offs could fuel intergenerational conflict, especially for those who are not economically dependent on the elderly, especially when you're talking about trade-offs, less for empathy, right, what we find, but maybe particularly in contexts in which intergenerational conflict is not really out in the open so much, right? So maybe it's a way in which you can accelerate something that is latently there. I'm not saying that Italians don't have intergenerational conflict, but it's just much more pronounced already in the Netherlands in the data. So, and then what we thought is maybe to do a follow-up study in Italy where we could see how we could move Italian public opinion more, right? So that was a little bit what we thought in order to kind of explore these context effects a little bit more. But I don't know what you guys think. I don't know how you perceive that. So I just wanted to put that out. So then kind of preliminary takeaways, very preliminary because we basically just did some of this. So highlighting the trade-off embedded in non-pharmaceutical interventions, increases intergenerational conflict, but only when it comes to attitudes and short-term behavior towards the elderly. So it hasn't maybe, it hasn't really has an effect on policy preferences. So the degree to which it then also translates into political, outcomes is then less clear, right? We're really not there yet. So neither inducing perspective-taking empathy nor prior levels of empathetic concern significantly reduce intergenerational conflict. Actually, empathetic concern increases the effect of the trade-off, right? So it's actually a little bit different than we had initially hypothesized. And high economic dependence does reduce the effect of highlighting the trade-off, but it does not increase the effect of empathy, what we initially had expected. And that what we find, which is quite striking, is that also this heightened level of worry about COVID-19 increases the effect of highlighting the trade-off, but then not so much the effect of empathy. And then the last thing I think is that these effects of trade-offs is treating the Dutch and the Italian case next to each other, where we know that there are a lot of differences in policy as well as in rhetoric, that we find that the trade-off effects are more pronounced in the context where intergenerational conflict is at a lower level to begin with. So there's more that can be moved. This is kind of what I wanted to present. I went in a very long and very quick presentation because I only have 20 minutes, but I'm more than willing to answer questions and any ideas you might have about how we could make this better, how we could also condense it, especially when we have these 5 outcomes, make it more slick, while still sticking to the pre-analysis plan by showing it, of course, but how we could make the message clearer would be very much appreciated.
Thank you, Catherine. As some of you know, but some of you might be new to the lab, you can ask your questions by typing them in the Q&A box, and Sanne van Oosten has already asked a question. I will read it out to you, Catherine, and actually add a little bit to this question. And then you can answer, and so feel free, those of you who have been listening, to ask your questions to Catherine. So Catherine, Sanne's question is, Sanne's wondering, when did you actually gather this data? And I'd like to add to that, if you can explain a little bit more what the sample size was and how this relates to the statistical power that you achieved in this study, especially in this sort of interactive models.
Yeah, great. So we ran the experiment in June. So it was actually a little bit after, because we thought otherwise it's going to be very affected by the hospitality rates and all these things. And it's going to be, then people could criticize us saying, well, that's the most likely case, right? So it was already dropping off a little bit. We were unlocking in Italy, we were unlocking in the Netherlands. So that's where we did it. I don't know if Sanne thinks that that's a good reason, but that's kind of the reason why we did it in June. And then Bert, we ran it with 1,800 people in Italy and 1,800 people in the Netherlands. Just because we were planning, you know, in terms of the power, we were planning to do all these kind of interactions, right? So hence we opted for more here than this. So we can then start talk about, is this, you know, what should we find and how we should adjust to that in terms of when it comes to size and significance, but that's a different. If you have ideas, then I'd like to hear.
Yeah, we might return to that later. Anonymous attendee, maybe the same anonymous attendee as last week, but maybe not. The clarifying question, could you show descriptive statistics for the survey experiments or talk about the general composition of the sample?
So descriptive statistics in terms of mean comparisons, or we haven't made those yet. I'm more than willing to make those. I don't know them off the top of my head, but definitely we should. So we just wanted to show some results, so we haven't dropped in totally yet. So the composition of the sample is basically a representative sample run by Kantar. So we did the programming and Kantar ran it in Italy and Netherlands. And this is on a representative sample that they bought, that they offered us. So one way, what we could do, for example, in the Italian case, we do have some regional variation, which I mentioned, and also in the Netherlands, of course, there's been regional variation in the degree to which COVID wasn't really an issue. And we can also vary it a little bit in the demographic composition. We haven't looked at that. We had pre-registered some of those things, but we just need to get we need to geocode some of the data. And especially for the demographics, that's much more of a concern in Italy than in the Netherlands. The only issue is in Italy that the demographic composition kind of correlates with how with COVID, right? With the effect of COVID. So we didn't know exactly what to make for that. But these COVID worry effects that we had, we thought it would be interesting to look at, are people from environments where COVID struck, you know, very much, or a little bit less. And probably in Italy we have more variation on that than in the Dutch case.
Thank you, Catherine. Next question is from Joshua Robinson. You can see some of his Danish connections. It's about deservingness. How do you see this study as fitting in the broader literature on deservingness, where older individuals are usually seen as more deserving for just the reason highlighted by the Italian quote, i.e., they have contributed to the social order over time?
Exactly. So that if we just look at the average effects when it comes to the control group, for example, in terms of like status of the elderly, you know, what did they get from society? We see more evidence of that deservingness idea and that's also what we know in the Italian context and in the Dutch context. So in the Dutch context, actually, you know, I don't know how one would formulate that, but there's harsher attitudes towards elderly, or there's less of that type of element. So in the Italian case, we see that, and I think it's a good element that you say. I didn't think about it in deservingness, but it's interesting in the sense that it may be also something that we should look at in a follow-up study. I have a little bit the feeling that these are messages that we did in the trade-offs that are not very much in the Italian debate. Right? So because it's very much about the elderly and the worth of the elderly. So therefore we got quite a lot, whereas in the Dutch debate, it's a very different context, not just policy-wise, but I think also what we said is that policy also reflects in public opinion. So we knew that, right? We knew that, but we were kind of thinking, oh, these policies will go this way, like then the Dutch will be more affecting on that trade-off. But maybe what we find is also something that you find in other public opinion surveys, is that if people haven't heard this so much, but then you can move people more in an experiment than when people have been saturated, to use kind of Zahler's term, right? So, but the thing is that I'm not sure if we fully convince you of that here, and if we maybe should do a follow-up, you know, in order to, in Italy, to try to get a sense of if that's the case or not, right? But this is a bit what we think is going on.
Yeah, thank you. Sanne van Oosten returns with a question about the fielding of the period of this survey period where you done this study. Her question is the following: since you ran the experiment in June, I feel there has been a switch in intergenerational discourse in the Netherlands. Do you see that as well? Youngsters are being addressed more clearly by Rutte. To what extent does this happen in Italy as well? And how do you think this would influence your experiment were you to run it again today?
So I think that's a great question. To be fair, I looked a little bit at that. That was a little bit later also in the Dutch case. It was basically from mid-July, beginning of August where that started to happen. It was the illegal raves, it was the illegal parties and so on. So that is another idea, and maybe I can talk to some of you. That was another idea that maybe we could run the experiment like again. I mean, I don't know if we have money to do it in both, but like run it again where it's switched, right? I think in Italy also, for example, there were pictures of the Navigli, which is the going out, area here in Milan. And there were all, here you have to wear masks, right? And then everybody was outside without a mask, drinking, like that. So it was basically this idea that young people, but to be fair, that debate and that rhetoric, I also looked at other countries, that starts shifting really kind of when the summer holidays. So it was really this kind of August where that really starts. And now it's very strong with students, right? And also discussion of Margaret Rutte about student housing and in Delft and so on. So I think if we would run that, Sanne, it would be interesting. So I don't know if you guys think that would be a nice way of doing it. So I was just a little bit like, what if we get a whole set of other results that go the other way? Should we just kind of go deeper into these? So this is also what we were amongst each other kind of discussing what would be the best way forward. So any ideas on that, I would be very welcome.
Okay, thanks. Next question is from Joost. Did you look into differences between men and women? More specifically, men may be less sensitive to the empathy treatment, and men may, in general, be less dependent on parents, the elderly, given that women tend to do mantelzorg, have to do more in intergenerational care.
No, great idea. We will do it. We didn't pre-register that, but in exploratory, it makes a lot of sense to me. And also we know in Southern economies that that's necessarily the case, that men are more likely to leave the home earlier than women, still on average, right? So, and that what you say is also caretaking responsibilities are disproportionately affecting one gender over the other. So I think it's a great idea, but we haven't looked at it. Thank you.
All right. Sander Stein, the next question. Thanks a lot for this interesting talk. To what extent do you think it would be possible to form a scale from your dependent variables? Or are you convinced that people see them as separate issues and do not take into account a general generational disposition?
That's a great question. So this is also a bit of a question of Bert, because me and Paula went over, I'm just saying you on pre-analysis plans. So this is what we do. So of course you get cleaner results when you, so basically what you get is you get, you have the behavioral measure on one side, you have the attitudes on one, and then you have the policy preferences on one. But we didn't pre-register that. So the results are easier to present like that, right? Because the attitudes go the same way and the policy preferences go the same way. And Paula has run all these beautiful graphs with that too. So we can definitely do that. And it also scales like that. So we tested that in either, kind of different ways of getting scaling. I just don't know what's the best practice. So maybe Bert, you have an idea if we can. And then what we could do is then do that, because it makes the story a bit easier. We're a bit with so many dependent variables. And then, have the rest in the appendix. So we're not hiding anything because we'll show, but the thing is that we didn't pre-register it. So I was more thinking about doing the two attitudes and then the behavioral measure, and say we also did the policy preferences. None of that is significant here. Everything is in the appendix. We were thinking about more that rather than making scales, because we hadn't pre-registered that. But I don't know what people think about
that. Well, since you asked me the question, I think this is one solution you propose. The other would be to add the pooled models as a separate coefficient in an overview plot. That could be the other way. But generally, I think as long as you're not hiding it, there are multiple ways in which you, especially if these dependent variables correlate super high with each other, then really the coefficients shouldn't look that different, right? So I think transparency is key here, and then I think there are many decisions to be made in with what you present where, and you have you've done an extensive study, so you might need to make some decisions of what is being presented where, as long as you label it clearly.
Yeah, and I think also with Sander's point about this latent generational concept, if you will, like we didn't have these measures all in one survey. So we couldn't pre-do and say, we should have probably just said that we were going to do a scaling analysis, right? So I know I will do that now, but anyway, but we couldn't test that before, right? So we were just not sure. We wanted to get as much of a generational possible latent variable kind of sense of different elements. And then I also thought it like that, but I don't know if you guys agree with that, that then you have these attitudes and short-term behaviors, which are things that you can move quite quickly. And then there's policy preferences, which probably just as ideology, we think are more long-term. Like people's ideas about pensions don't change from one day to the other usually. Right? I mean, that's what the entire literature on redistribution is about, and pensions. So in that way, that's also one of the reasons why we wanted to put that policy dimension. And it does give you a sense of what could you politicize of this COVID, or what is the reason of this COVID thing, right? That maybe we see some of these things in countries where the intergenerational conflict is not that high, but mostly more on these short-term things like attitudes that are more movable, but not necessarily yet on policy preferences. And then the question becomes, when a party starts mobilizing that along policy preferences, are we going to see that in the future? And hence that I was thinking, maybe could we, by adding some of these mobilization vignettes, for example, could we do a follow-up study in Italy where we show that could be mobilized through party rhetoric? There are some smaller points that have been made, so we don't have to lie. We could take something from an editorial of a newspaper, for example, right? And then use that as to say a politician said or something like that. But like that was a little bit what we were thinking about. But I agree with you. I think that people have, that some of these things are as they are, they're clearly correlated. So I think that we'll move one of those things that was suggested. We'll do that because I think this is just too much information. I think it loses a little bit the clarity of it. So we just need to figure out how best to do that.
Yes, okay. Next question is from Jordan Mansell. Jordan asked the following question, a very interesting project. The null findings on the perspective-taking manipulation are consistent with the operational definition in the cognitive sciences. It's actually more a suggestion. You may wish to look at the work on empathy by Jamil Saki to explain the observed outcomes. So maybe if I can add a question to that, how confident are you that the empathy manipulation worked? And how does it relate to the work by others that have been inducing empathy?
Hi, Jordan. I used to know Jordan from Oxford, so that's really nice. Sorry, I don't see you now on my Zoom, but it doesn't surprise me that Jordan comes up with something from cognitive science. So I should definitely look into that. I'm not aware of that. I was not aware of this particular one, so I'm really super helpful of that. So what we are basing it on is some of the work of Vicky Vuka and Elias Dinas, and some of the work that Claire Adida and co-authors. And the way that some in PNES, some in JOP, and the way that they do so the empathic concern is by Simas et al. With this APSR paper. And then this perspective-taking empathy is from the way that they induce it. And we do it in a very similar way. We also had them to look at our pre-analysis plan, but they do it on oftentimes about immigration and immigration attitudes. So it's really a different group that we're using now. People that are totally different from you, right? So that's the thing. And also something that you might become old. So I don't know if perspective taking would work in exactly the same way, but it is based on other research where we just, try to replicate this. And then especially do that. So what we haven't done yet, as I told you, we have these open questions, so we can very easily check, Bert, into what extent, quote unquote, it worked, right? So we've looked a little bit into that. It seems quite okay, but we haven't systematically, and we should definitely look at that systematically. And one way in which we could also do that is what Elias and so on do, that they do some analysis where they they show the overall analysis, but then constrain it on those people in which it really worked to try to see that. But to be fair, I have also had a little bit in these empathy things that I think that it's quite tricky, right? So to do this kind of perspective-taking empathy. So I am also not entirely surprised that it didn't work. Although then Scott Williamson, who's one of the people on my future colleague, who's one of the co-authors on this immigrant paper with Claire Adida, he was like, "Oh, this is a very thick empathy, like a very strong empathy treatment." So we were kind of expecting to find something and we don't. So that is kind of interesting. The only thing that what we haven't looked at extensively yet, that we wanted to look at those people who are closer to 70, and for them maybe, because it's so close to them, that for them that works more. Right, so that now it's this average, and that we look a little bit at the heterogeneous treatment effect on age, and that's something that we wanted to explore. But I will definitely look at this, and I also fully agree with what you say, that it's not so easy to induce empathy, I think, in an experimental setting.
Okay, a follow-up from Sander Stein on the previous point on scaling. It would have indeed been great to have pre-registered the scaling analysis, but hindsight is 2020. In the current situation, I fully support Bert's advice. Transparency is key. As a reader, I would very much be interested in the scaling and the scaled analysis, but would interpret them with some additional caution.
Yeah, I think so. What you get basically on the fact is, I see what we get consistently. So we find these effects for share, for the status, and elderly get their fair share, and they move in very similar directions, as you saw. Of course, that's what we find with the scaling as well, right? And then what you find on the policy, that there's nothing going on, which we didn't really find anyway. So in that way, I think the scaling really does clarify the message a little bit more, but we will report anything anyway. One way would be also to just show those two different attitudes, to show the behavior, and then say we also tried policy preferences, which we in the pre-analysis plan said that we probably were less hopeful that we would find effects on that, because for the reasons that I outlined. So then we can say, well, in line with that intuition, we didn't find anything, but here, look, we give you all of it in the appendix, right? So that's also a way of dealing with it. So we just have to think about what's the best way. But I do think that, I think from this, I think it becomes clear that it's a more complex story, right, that we're telling. So I think it doesn't lend itself to just say like, 4,000 words, here are the results. And, like that's not what the study is for. I think it's a little bit, longer study, and hence that we were thinking about maybe doing some content analysis of the debates, and also looking at a potential follow-up. So if you guys have any idea what you think would be interesting as a follow-up, we would be super interested in that.
Okay, Gijs might have some ideas on how to spend your money.
Yeah, always. I know you. I mean, you can't change the current experiment, but I do wanted to add some reflection to that, and maybe that will help for the future project, or maybe for the interpretation of the effects.
Mm-hmm.
What strikes me is also the large difference between the two treatments. I mean, they're not only they're not only topical differences, but also the setup is quite different. And
so the one is about, you mean the one is about a person, and the other one is more general?
Exactly. Mm-hmm. Yeah. So one is a personal story, and the other one is just. I mean, I guess the good framing is that the Marianne Zwagemans and Jort Kelders actually have no effect on public opinion. I think that's one way to frame it. And I mean, that's a story everyone wants to hear, right? So. No, but indeed, there's sort of a factual story and a personal story, and that I think is a bit. And then I wonder, particularly with the factual story, how much people have really engaged with this. It's a cognitively high demanding treatment, and I mean, I had some pretty demoralizing experiences recently with people not even being able to answer very simple questions in surveys. So maybe you took some precautions for that. But yeah, I mean, I would be more than, say, playing around with more of the social demographics and heterogeneous treatment effects. I would be more interested in sort of seeing more treatment variation in the treatment messages, and the direct effects of that.
So the thing is, in some ways, I think you're right, in the sense that there's a difference in length, which we've explicitly talked to other people about, and that seems to, that seems to not be so much an issue when you then look at, because in that way, that's why we wanted to have these open questions, so that if we would have much less people responding in the long open question, then there would be an indication of fatigue in the experiment, right? So, and that's not what we seem to find. Then the thing is, actually, I expected, Gijs, the other way around. So I expected if I give something about a person, people are more likely to be affected by that than some general thing. So I expected actually, if there would be a bias, that it would be towards empathy. But like we didn't find that, so that might be interesting. But the interesting thing I think is that people really engaged with this trade-off. And you also saw that in the Prime Minister questions like that were responded. I wrote some things like, just in Dutch, like lengthy things that people write, like really lots. And it was so, and then people were luckily also saying things like, oh, this is a great survey, super interesting questions, because it's a bit different than what you normally get, maybe. That was kind of interesting. But there was these things that, Mark Rutte, I think you're doing fine with COVID, but you really need to think of elderly people. It's not only about economic activity, that you got a lot. You got a lot of that. And I think that was a little bit this discussion of that. That was also a bit in the newspapers, right? That it was all about the economy. And it was not about like human worth or something like that, right? So that I was quite struck by in the Dutch one. In the Italian ones, with Paolo did the coding, there was a lot of stuff about, well, don't forget the unemployed youth. And this lockdown is even worse for the unemployed youth. But it was also a lot of interaction with this trade-off. And I wonder if that was also the fact that that was really highlighted a lot, right? So it was really a lot about this contention over trade-offs. So in that way, from looking at those kind of things in the open questions, I was not entirely surprised that we then found that. But to be fair, when we put it in the field, I thought it would be the reverse because of this man of 82 and things like that. So I wondered, I mean, that might also be something that I wonder if you even give this trade-off even more personal, that the effects would be higher. So if you basically had like a little interview with someone who's 18 in Milan and cannot get a job because of the lockdown, and this is all Conte's fault because he, whatever, something like that, no, that you would get more from that. And I do think that, coming back to Sanne, that might have changed over time. So that I think that the elderly versus young is more, at the time that we were probably running it, Sanne is probably right, that it was very forced about the cost of the lockdown but I think that what you're suggesting, when I read from what you're saying and also what Bedford's saying, which we haven't done yet, but to really give much more information on the open questions, code them, give information on what that is, or we can do a machine learning thing, like to show you that information. And in that way, we are quite comfortable with the things that we think that is working. With the empathy, it's indeed this question of like, how can you induce empathy, right? And is it really credible? And the one thing maybe that we were thinking about, but we didn't do, because it would be like to have like, I think if you do a little clip in Italian that someone is interviewed like that, like that might get more closer to this than just having a statement of a guy that they don't really know, right? So it's, it's like, hey, I'm Gijs, I'm 78 years old, and I had COVID. And if you do it like that, I think
38.
Yeah, exactly. So, like something like that, right? That it would be the kind. So would you say that, I mean, the issue is a little bit, we run this, right? So I can give you that information, but then rerunning, saying, oh, we didn't do the experiment well enough, I'm going to give you another experiment with the same thing, is also a bit odd, right? So I think that the one way to deal with your question is to do more with those open questions, which we are planning to do anyway, definitely. And that's why they were there, in order to get a better sense of if the treatment worked.
Yeah, thank you, Catherine. A suggestion from Jordan Mansell. Catherine, if you're looking to run a replication, one method this on empathy, one method to use to induce empathy or perspective taking would be to ask participants to recall in an open response a similar situation where they were subject to a similar threat or restriction to the elderly subject. Results might be further conditions on whether participants actually recalled such an experience.
Yeah. So one thing that I was thinking about that is that I think one way. So we had thought about this. But we thought actually in this case it might be quite tricky to find a situation in real life that would fit itself in that way, but like that's why we decided not to do it like that, but to still have this, imagine yourself being like an elderly person, and like do this perspective taking. But I do think that underscores, so if we do a replication, definitely, and then if it also underscores that it is important maybe to look at to maybe distinguish the group that's close in age to the person that we're describing versus those who are further away, right? So we do know that matters. from studies. So in that way, I think that would be a way I would go as well, in the degree to which that's the case. The interesting thing is that what we then don't find, which I would expect again, that this COVID worry does the empathy, would have done something on the empathy, right? Because that's also like that you're in a similar situation, you're very worried about the disease, and then that might be, but that we also don't only fight on the trade-off and not on the empathy. But yeah, it could be well that it's just not well designed. But I mean, it's very designed with all these people who do find all kinds of results. But yeah, we didn't find it here.
Okay, thank you, Catherine. I think if you can, for me, if you can validly show that the empathy treatment was valid, I think that's important. But it also, with these generally small effect on big concepts with subtle treatments, who knows whether or not this might just really work in very specific conditions on very specific issues, and therefore I think it's important to document these null findings if you can indeed convincingly show that empathy was induced. That said, I want to thank you for your talk, and Gijs will do the formal roundup and announce nice things.
Yeah. Also on behalf of me, thank you, Catherine, for this engaging talk, and good luck with the follow-up research. When Katrine talked about unemployment, I suddenly realized I forgot sort of the most important aspect of one of the two most important aspects of my introduction, namely the fact that we're searching for a postdoc. So we'll be hiring a postdoc for a short period, 16 months, only research. And we're looking for someone who can complement our team. So you'll be working in something related to emotions in politics, and there are a couple of themes I advertised on Twitter that we might think of, but maybe there's something we don't think of, and you think you can make a big contribution. And so I'm really open to that as well. The formal application will be online next week, if I get the admin to move on it. That said, Catherine, you will get our Hot Politics Lab coffee mug. Yes. And
I want it.
I was looking for an example, but I think I actually cleaned up here, so they're not here. Let me announce the remainder of the schedule. So next week we have Graduate Friday. And that means we have 2 PhD students presenting their work. We'll have Haley Kelsall and Christian People, both from the University of Amsterdam Department of Political Science. And Haley will talk about her project, Political Information, Diversity, and Effective Depolarization. And then Christian People will talk about emotional appeals in parliamentary debate. The weeks after, we have an exciting program. Lina Aru will be presenting on evolutionary psychology and citizens' dissemination of political news. Manos Tsakiris will give a talk about experimenting with the visceral dimension of visual politics. And then on October 16, we have Robert Clemenson from with a talk about with a talk titled "Elites, Are They Different?" So that's what's ahead of us in the coming weeks, and I hope to see you. Well, you will see us.